Hello and welcome to King Mash Show, where we create a positive impact through both your health and lifestyle. So today we are going to continue with the pregnancy topic, and we are going to be checking what are the vital signs that we are checking on your pregnancy and what are the normal ages that we consider being normal. So we are going to check the vital signs are so similar between a healthy person or a normal human person and the pregnant person. So there is no change of vital signs because you are pregnant, then your vital signs becomes different in measure. So we are going to be checking on what are the normal vital signs for 13 years old and above, because you expect by the time you're pregnant, you should be at least 13 or 12 and above, whereby you have started experiencing your menses. So we are going to check for 13 years and above. So for the temperature, it's usually universally the same, whether you are a child or an adult, and we expect it to be between 36.0 all the way to 37.2 degrees Celsius. You'll find some books will say between 36.5 all the way to 37.3 degrees Celsius. It's still okay. So it varies from different ranges, but capturing the whole range should be between 36 to 37.2, which is clinically acceptable. Some will take even as low as 35.5 as also a normal temperature for an adult, depending on the weather and such stuffs. Another thing that you need to check, or we do check, okay, just before we come from temperature, in case your temperature goes high or low, could be an indicator for infection. So you'll see some more lab works done to you in case you end up having a very high temperature or a very low temperature, or if they are not in a position to do the lab test, then you might end up being initiated to treatment for a suspected infection. Maybe they consider what's an outbreak in your region and they treat for the same. Maybe if it's a flu, they give you some treatment for flu or such stuffs. Maybe depending on other symptoms, they may diagnose you clinically or do some lab tests just to see what's happening. Another thing that changes is we should check is the heart rate. Normal heart rate for a person above 13 years should be between 60 to 100, and this is calculated as beats per minute. So your normal heart rate should be between 60 to 100 beats per minute. You'll see this varies especially for the pediatric, for the kids. This is the measure that usually really vary from one child to the other. Other thing that we check is the blood pressure. The normal blood pressure for a resting adult should be between 90/60 to 124/80 for resting. But you'll see this in mmHg. Meters of mercury. But you see, it's also usually acceptable in most of the facility. You see, they will tell you a range of between 90 to 140. For the systolic, maybe you are active or some other small parameters. Otherwise, any up to 140, it's not any risk to any health worker. So you'll see they saying it's acceptable between 90 to 140 and between 60 to 90. This is because maybe you are not well rested, or you could be having some small triggers which may lead to a range of even 140/90. So between 90 to 140, it's considered as normal. Between 60 to 90, it's considered as normal. But most of the books, you'll see them instructing you between 90 and 60 and 124/80 is the normal blood pressure for a resting adult. Other thing that we check is the respiratory rate. We do say respiratory rate is the rate of how you're breathing, and your breath should be between at least 12 to 20 breaths per minute. So you should be having at least 12 to 20 breaths per minute. It might be alternated due to compensation, maybe you are ill or something. So in case it's above 20, we check what could be the cause of you, or what could you be compensating to. In case it's below 12, we also check what could be the cause and maybe try to manage. But the normal range should be between 12 breaths per minute to 20 breaths per minute. In adjuncture to respiration rate, we mostly check on how the oxygen is saturating on your cells, and that we achieve it by doing the SpO2 measure. That's why we place a small blinking thing in your finger just to see how the oxygen is saturating, and that should be between 94 to 100. But due to some, like in our country, between 90 to 100 is accepted due to the climatical effects or the methods. Maybe you are grown in a place where you use firewood and such stuff. So between 94 to 100, it's okay. It's what considered normal. But again, as I said, in our country, like in Kenya, anything above 90, we consider it being normal because of the effects, the environmental effects. And lastly, but not least, the last vital signs that we said, which is very common, very crucial in pregnancy, is weight. And we consider your weight in calculation with the BMI. BMI is the body mass index, and which is also associated with your height. So through your height, you're able to calculate your BMI and able to instruct to you what should be the normal weight. But in pregnancy, what we do say, very common in weight should be always be moving upward. You should never have at any time weight moving downwards. So in case you're losing weight, we need to check what could be the problem. Is it poor nutrition? Is there any retardation in fetal growth or such stuff? So we expect your weight to be going high and never to be going low. So it should always be going high. Thank you so much for listening on the vital part. Let's see you in the next one, where we shall be discussing different labs which we do for antenatal mother and how they are important in your pregnancy load. Thank you so much. See you on the next one.